The Zika virus was first diagnosed or reported in Uganda in 1947. Since then, there have been outbreaks in Africa, there have been outbreaks in Asia. The most current outbreak has been reported in South America. It was believed first cases occurred in Chile in 2014. Subsequently, the World Health Organization reported uh, cases in Brazil as of May 2015. As of date, there has not been any reported case in North Carolina. There have been travel-related cases in America. There have been cases reported in Florida, California, and some other states, including Texas. Uh, Approximately about 35 cases have been reported, but these were travel-related cases. These patients had been in these areas. There were pregnant ladies who had been in these areas and were believed to have contracted this virus from there. There may have been two locally reported cases. However, this has been in Puerto Rico and in the Virgin Islands. The thing to recognize about this virus, this is, like I said initially, this is a mosquito-borne virus, meaning it's transmitted by a mosquito known as the Aedes mosquito, is spelled Aedes. The thing about this mosquito is it breeds in stagnant water. It can breed in flower pots, um, residual collections of water, and it is known to bite during the afternoon time. It feeds on human blood. So, what has been put out by the CDC and other public health officials is to avoid mosquito bites. Uh, it's recommended that people wear long sleeves, they use insect repellents, and then try to destroy these stagnant water areas around your homes. The virus is basically transmitted when it bites someone who has the Zika virus infection and bites somebody who becomes close to this person, then it transmits the virus that way. Other modalities of transmission, there have been reported cases of sexual transmission, and there's also been reported cases of blood transfusion related cases. Now, the infection on its own is really a very mild infection. People will get fever, rash, which is described as maculopapular rash. They will have conjunctivitis. This usually starts about 2 to 12 days after they have been bitten by an infected mosquito. Um, this usually lasts anywhere between days to about 1 week. It's a mild illness, like I said, and people usually recover fully. But the concern has been with pregnant patients. What really happens when they get this infection? Um, there is some suggestion or some reports of in utero transmission, which has led to these associations with congenital abnormalities when these babies are born. Like cases of microcephaly have been reported in Brazil. There's also some reports of Guillain-Barré syndrome as a result of this infection in pregnant females. Now, the question does come: what do pregnant patients do to protect themselves from this infection? At this time, the CDC is recommending to postpone any non-essential travel to these areas that have been reported with this infection. This include areas in Central America, areas in the Caribbean islands, and areas in South America. Now, in the event that you come back into the country and you suspect that you may have contracted this virus, it's recommended that you get in touch with your provider as soon as possible. There are tests that can be done for the the virus. There are also testing that can be done to find out if the baby is also infected. So it is highly recommended that you get in touch with your provider who will guide you with these testing. The CDC puts out updated information at least every week. People can go to the CDC website. They can also get in touch with their healthcare providers. They can also actually go to the state health websites. At this time, we don't think there's any need to be overtly alarmed. Like I stated earlier, this is actually a very mild illness, but the concern remains in pregnant females. And the World Health Organization, the CDC, is doing a great job updating the public, updating healthcare providers as well as the public with any changes as this goes on. It is being very closely monitored, and recommendations are being put out to the public.